Good evening, everybody. This is Dr. Deepak Krishnamurthy, Senior Consultant Interventional Cardiology from RxDx Multispeciality Clinic, Whitefield, Bangalore. I welcome you all to this evening session on the event of World Heart Day 2021. As we know, every year, 29th of September, we celebrate World Heart Day. And world over, uh, we know that cardiovascular disease, heart attacks, heart disease is the number one killer. Even in India, the number one cause of death and major illness is cardiac disease. So we will try to learn a few things about uh, heart disease. Specifically, I am going to talk a few things about this diagnostic modality, that is coronary angiogram, in today's session. Coronary angiogram or coronary angiography is a diagnostic modality which we use to look for blockages in the blood vessels of the heart. It is an imaging modality. It can be done in two different ways. One is, of course, a conventional coronary angiography, which we perform on an admitted patient in the hospital in a cardiac cath lab. It is an invasive procedure. We either do this from the wrist or from the groin, where we enter into an artery, pass a small catheter, which is a thin catheter or a tube, towards the heart, engage the coronary arteries, and inject a contrast or dye agent in order to look for blockages and to quantify these blockages in the heart. The other type of coronary angiography is what we call as a CT coronary angiography, where it can be performed on an outpatient basis in a CT machine in a radiology department, where the contrast or the same dye agent is injected intravenously. We do not pass a tube to the heart in this CT angiography. We basically inject the dye intravenously and then do a CT scan on the heart, and the arteries of the heart are imaged in a specific way to look for blockages. So these are the two basic types of coronary angiography. One is a conventional angiography done in a hospital, which is an invasive procedure. And the second is a CT angiography, which is performed non-invasively on an outpatient basis in a radiology department in the CT machine. So who are the people who require a coronary angiography? And which are the type of patients who will undergo a conventional angiogram, and which are the type of patients who will undergo a CT angiogram? We know that heart disease, especially ischemic heart disease or coronary artery disease, is the major cause of death world over. Heart attacks are the number one killers in India as well as in other countries. What happens in a heart attack? What happens in somebody suffering from chest pain is that there are blockages in the blood vessels supplying the heart muscle. The heart, as we know, is a muscular organ which pumps 60 to 90 times per minute from the time you are in your mother's womb to the time you are alive. It has to keep beating 24/7 without stopping at any moment, and the heart's major function is to pump blood to all the parts of the body. So this is like the engine of a car, and the heart has to keep pumping. This heart muscle, the different chambers of the heart are made up of muscle, which is known as cardiac muscle, and this needs its own nutrition, for which there are coronary arteries, basically blood vessels on the heart, which supply the heart muscle itself with oxygen and nutrition. When there are blockages in these coronary arteries supplying the heart muscle, one develops chest pain or angina when somebody walks for a distance, when somebody does a physical work, climbs stairs or walks up a slope or runs, they may develop discomfort in the chest or heaviness in the chest, what we term as angina. This is due to gradual development of blockages or narrowing within the arteries of the heart. This can also happen more acutely, which we term as a heart attack. Somebody suddenly develops chest pain, sweating, burning sensation in the chest, breathing difficulty, sweating, nausea, vomiting, giddiness, acutely, when there is a 100% block in one of the arteries. Usually there is a cholesterol buildup over time. Suddenly that becomes 100% due to development of a clot, leading to a heart attack, which is an acute event causing acute chest pain and discomfort. Whether it is due to angina or whether it is due to an acute heart attack, your doctor will advise you to undergo a coronary angiography. In emergency situations like a heart attack, or when the doctor is fairly certain that you are suffering from severe degrees of angina, they will advise you to go for a conventional angiography, for which you will have to be admitted to the hospital. Certain blood tests will be done, including hemoglobin, platelet counts, your kidney function tests. And after that, an ECG and echocardiogram will be done to look for the heart function. And then you'll be prepared and made to undergo an angiogram, as I mentioned, either through the wrist, through the radial approach, what we call, or through the femoral approach or the groin. So once this angiography is performed, during that the doctor will look for blockages, assess the severity, the percentage of blockages will be mentioned, and a report will be generated. And after the angiogram, the doctor will discuss with you as to what should be the next course of action, which may be only medical treatment. It may be angioplasty and stenting to relieve these blockages. Or if too many blockages are there which cannot be treated with medicine or angioplasty and stenting, you may need a cardiac bypass surgery. These are the usual three modalities of treatment after you undergo an angiogram to treat the underlying cause. If somebody does not have too much of a severe angina, somebody is not suffering from a heart attack, it is not a very acute situation, and we doctors are not really sure whether you're really having blockages, and the angina or the symptoms are not very severe, we may advise a more non-invasive CT coronary angiography, which can be done in the radiology department, as I mentioned earlier, in a CT scanner, and we can also make a diagnosis of blockages. But the only thing with a CT angiography is that if you are found to have some blockages on a CT angiography, you may have to undergo a conventional angiography later to exactly quantify and confirm the findings of CT angiography to go ahead with further treatment. Although CT angiography is a good screening modality where one can make out blockages are there or not, we cannot completely base our treatment on the basis of a CT angiogram. If the CT angiography comes normal, of course, we can clear you saying that you do not have any blockages. There is no need to do anything further regarding this. But if you are found to have some blockages on a CT angiography, you may have to undergo a conventional angiography in a hospital so that further decisions regarding treatment like angioplasty, stenting, or bypass surgery can be taken. So this is basically about the coronary angiography. How does one prepare for a coronary angiography? Of course, if you're getting admitted in a hospital, the doctor will give you all the detailed instructions. As I mentioned earlier, you may have to go on an empty stomach to the hospital, or if it is a daycare procedure, you may also be allowed to eat food and go to the hospital. There they will prepare you, do some basic laboratory tests, an ECG, echo, and then do the angiography. Are there any risks of undergoing an angiogram? Any procedure done on the human body, including an angiogram, will have its own risks. Of course, in a healthy individual otherwise who has a normal kidney function, who has normal hemoglobin and platelet count, and his blood pressure and sugars are under control, an angiogram is a safe procedure. Minor allergic reactions to the contrast agent or the dye used in angiogram can happen. People may develop rashes and sometimes serious allergic reactions, but these are very rare. If your kidney function is not good, which is indicated by an elevated creatinine level in the blood, the doctor may postpone your angiogram or ask you to see the kidney specialist first, the nephrologist, get some treatment done or get a clearance from the nephrologist if it is safe to undergo an angiography, administer certain medications before doing the angiogram, and then do it. So these are the basic issues. And of course, once you're undergoing an angiogram, you need to be discussing with your doctor as to after angiogram, what are all the possible therapeutic modalities, what are all the treatments available. That preliminary discussion should be done before undergoing an angiogram so that you are mentally prepared based on the angiogram findings to go ahead with further treatment. In case of emergency angiography, like which happens in a heart attack. Somebody suffers acute chest pain, they are brought to the hospital. Of course, there is not too much time to lose here. You will be quickly explained as to what the doctors are going to do. Of course, there will be an emergency angiography procedure. We may not wait for all the blood reports to come, because within minutes you will have to be taken to the angiography suite and you will have to undergo an angiogram immediately, so that the 100% blocked artery can be identified and immediate stenting can be done. So in angiography, now you may understand that there is an elective angiogram which is done in a more stable patient who is suffering from chest pain over some time, in whom initial tests like ECG, echo, treadmill tests have indicated some problem, and the doctor is going to do a conventional elective angiography, where you have time to decide, time to prepare yourself, time to get all the blood tests done, discuss with the doctor, then undergo the angiography. One is an emergency angiogram, which is done in a heart attack setting, where you do not have that much luxury of time to decide, but you will have to quickly take a call as to and discuss with the doctor briefly and give your consent for the angiogram, because saving life is more important in a heart attack. You do not have too much time to discuss all the pros and cons of an angiogram and what happens later, because saving life takes precedence over there. CTangiogram, as I told, is more of a screening test in low risk or intermediate risk individuals. Definitely not in a heart attack. CT angiography cannot be done in a heart attack patient. It is done on an outpatient basis for more milder degrees of symptoms, as a screening method. So this is basically about coronary angiography, conventional angiography, which is done on an elective basis or an emergency basis. What are all the possible outcomes after an angiogram? As I mentioned, medical treatment or stenting or bypass surgery, and also about emergency angiogram and angioplasty and stenting. It is not something dangerous. Many people have the impression that coronary angiogram is a dangerous test. Once the test is done, it may affect the kidneys, it may cause problems, you may not be able to lead a normal life. Definitely no. Modern technology is very advanced. The newer contrast agents or the dyes what we use for angiography are very refined, and these have very minimal, very low risk of allergic reactions or any adverse events on the body. Once we do the angiogram, within 5 to 6 hours or 12 hours, all the dye gets washed away from the body and it is excreted by the kidneys and the urine. Nothing stays in the body, and it is not something which causes long term damage or any risk to the human body. It is a safe test to undergo, but of course, everybody should not be undergoing a coronary angiogram. Everybody should not be undergoing even a CT coronary angiogram. It is only when your doctor feels that based on initial tests you may be having blockages, the doctor is fairly certain that by doing an angiogram we will be able to make more uh, in-depth analysis of what is the reason for these symptoms and how much of disease you have. Only then an angiography is advised. Not everybody who comes to a cardiologist will undergo an angiogram. So, when carefully selected and risk stratified and then taken up for an angiogram, the results are analyzed, and then therapeutic decisions are given, which you can discuss with your family and then take the correct treatment modality. It may be medical treatment, it may be a stenting, it may be bypass surgery. Those decisions can be arrived at after the angiogram. But in emergency settings, please do not lose time. Please do not discuss too long, to take too much time to decide, because when you are suffering from a heart attack, when you're suffering from acute chest pain, every minute is crucial. When your cardiologist says you have a heart attack, you will need an immediate angiogram, you should agree and you should undergo, so that the doctor is given a chance to save your life. This is very important, what we call as the golden hour. When somebody develops severe chest pain, when somebody goes to a hospital with heart attack, within 1 hour of onset of chest pain, onset of heart attack, if the doctor is able to do an angiogram and do an angioplasty, more lives can be saved. Minimal heart damage will be there, or there is no heart damage when angioplasty is done within 1 hour of onset of heart attack. So this is very important, that you do not lose too much time in heart attacks. That helps us to save the heart, save the life, and many more people can walk home without much of a problem and without much risk of long-term complications when an emergency angiogram and angioplasty are done in a heart attack setting within 1 hour of onset of symptoms. So this is very crucial. I always tell uh, whenever I'm talking about heart health, that just like you have a fire escape plan in a building, in an office, or in an apartment, you need to have an emergency medical plan. You need to have your ambulance number, you need to have the nearest clinic or hospital number handy, you need to have your family physician or cardiologist number handy, because whenever there is a person suffering from acute chest pain, be it in an office, be it in your neighborhood, be it in your community, in your apartment, in your office, there is a need to immediately get in touch with the medical service, get the patient in an ambulance to the hospital as quickly as possible, so that early diagnosis can be made and the heart attack can be treated immediately without much delay, so that the life can be saved. Every minute delay causes damage to the heart muscle. Even if we provide treatment after the damage is done, the heart may not recover completely and may result in long term complications like heart failure, where the heart is not able to pump enough blood to meet body requirements, various rhythm disturbances of the heart. There is decline in the quality of life, and the person does not really live long after a damaged heart due to heart attack. So it is very crucial to follow these rules. Keep your emergency numbers and ambulance numbers and hospital numbers handy, so that the patient can reach hospital in time. This 2021 World Heart Day, we should pledge to take care of our hearts, prevent heart disease in the first place. So, I will be taking a few questions which are commonly asked about heart health after this talk about coronary angiogram. So, the first question is, what are the common symptoms of heart disease? Most common symptoms of heart disease include chest pain or heaviness in the chest or chest discomfort, especially when walking, when doing some physical exertion. If you get chest discomfort in the center of the chest, which may spread to the neck or jaw or to the arms or to the back, especially if it is associated with sweating, breathing difficulty, palpitations, or feeling your own heartbeat going too fast or irregularly. These are all the usual symptoms of heart disease. Apart from this, coughing during the night, breathlessness on sleeping, swelling of feet, distension of the abdomen. These are all some of the common symptoms. Easy fatigability. Suppose 6 months ago you were able to walk around without much of a problem, climb 3 floors of stairs without any issue, but now even on climbing one floor, you feel tired. When you do normal day-to-day activities, you feel very fatigued. These are all the usual symptoms of heart disease. What is the importance of annual heart health checkup, and which age group should ideally go for it? The importance of annual heart health checkup, I would say, is mainly to look at risk factors, because heart disease does not just affect anybody. Heart disease and heart attacks are more common in people who have certain risk factors, which include diabetes, high cholesterol levels, hypertension or high blood pressure, a strong family history of heart disease, sedentary lifestyle, not exercising enough, smoking or abuse of tobacco in any form. These are all the usual risk factors. Of course, being overweight, being obese also adds to the risk. And stress is also an important risk factor. So when we do an annual health checkup, we are not trying to detect who has heart disease, who doesn't have heart disease. Of course, that is also possible if somebody already has heart disease. But the main idea of a heart health checkup is to identify risk factors, and by identifying risk factors, we can risk stratify as to an individual has how much risk over the next 5 years, 10 years, and based on that we can advise about lifestyle changes, about medication, about risk factor modification, stopping to smoke, controlling your sugars, controlling your high blood pressure, controlling your cholesterol. These are all the main goals of an annual health checkup. More than detecting heart disease, it is about finding out risk factors you have. And which age group should ideally go for it? I would say nowadays we are seeing people with heart disease as young as 30, 35, younger than 30 as well. So there is no age limit per se. I would say anybody above the age of 25 should have at least an annual or at least once in 2 year health checkup to look for risk factors, to look for features of heart disease, so that early intervention can be done. We can modify the lifestyle, we can modify the diet, we can modify the physical activity, thereby preventing heart disease. Heart disease is all about risk factors and getting rid of risk factors or reducing the risk factors. It is like driving. You drive a car or you ride a bike, you follow all the safety instructions, you follow the traffic rules, you don't drink and drive, then the chances or the probability of reaching your destination safely are very high. If you do not follow any traffic rules and regulations, if you drink and drive, if you do not wear a helmet, then your chances of reaching your destination are low. The chances of meeting with an accident are high. Heart disease is like that. If you take care of all of your risk factors and your lifestyle and diet and exercise, your probability of getting a heart attack becomes very low. But if you do not take care of your health, you do not exercise, you eat excessive amounts of sweets and sugar and fat, you smoke, you consume alcohol, then your chances of developing a heart attack become that much higher. So it is all about reducing or increasing the probability of heart attack. So an annual health checkup basically helps us to identify these risk factors and bring down the probability of developing heart problems. Are both, next question is, are both male and female equally vulnerable to heart diseases? I would say up to a certain age, at least till menopause, women have a lower probability or possibility of developing heart attacks because estrogen has a protective effect on the heart, prevents heart attacks. But once women reach menopause, the risk becomes as equal as men. And also we need to understand that in women who smoke, in women who have diabetes or high blood pressure, the risk is as much as men. So this protective effect of estrogen is not there if you are diabetic, if you have blood pressure, or if you smoke. And once you reach menopause, this protective effect no longer exists. So I would say at a younger age, women are less likely to develop heart attacks. But as they grow older, and especially after they reach menopause, the risk becomes the same as men. The next question is, recently many young people have succumbed to heart attack and heart disease. What advice do you have for young people to maintain healthy heart? So the most important thing, as I mentioned earlier, is to keep your risk factors low. Maintain ideal body weight. Ideal body weight can be calculated very easily. Measure your height in centimeters, subtract 100. So if you are 165 centimeters height minus 100, 65 should be your 65 kg should be your ideal weight. If you are 185 centimeters tall, 85 kg is your ideal weight. So try to maintain ideal body weight. Don't eat excessive amounts of carbohydrates, especially refined carbohydrates like sweets, sugar should not be consumed. That causes a tendency towards diabetes, heart disease, obesity. Reduce or totally avoid aerated drinks, avoid junk food as much as possible. Try to consume wholesome home cooked food, fruits and vegetables. If you are a non-vegetarian, avoid red meat as much as possible. Chicken and fish are okay, eggs are okay. Use fats in moderation. Nothing in excess is good. Fats should not be zero. You need some fats because essential fatty acids are important for body metabolism. But eat fats in moderation, not more than 2 to 3 teaspoons of oil or ghee or butter in a day is what we recommend. Coming to oils, avoid seed oils, especially refined oils, as much as possible. The most important advice for young people is to exercise regularly, keep their body weight ideal, and don't smoke. Smoking is the most important single risk factor which we have seen in most of the young people coming with heart attacks, and you need to stop smoking. There is no safe limit to smoking. Even if you smoke a few cigarettes a day, you may still end up in a heart attack. So stop smoking. That is one important thing all young people need to do. Never start smoking, and if you are already smoking, stop it today. That can reduce your risk of heart attacks by a huge margin. Are COVID patients more vulnerable to heart ailments post recovery? Especially moderate and severe degrees of COVID, especially hospitalized patients with severe forms of COVID, are at risk of developing heart attacks, are at risk of developing heart failure, myocarditis, or inflammation of the heart. Even after discharge, up to a few weeks, they are at slightly higher risk of developing heart attacks. Yes. So it is important to vaccinate yourself, wear a mask wherever you go, practice social distancing till the COVID pandemic goes away. It is important. And people who have severe COVID or moderate degrees of COVID and hospitalized should meet a cardiologist and take some blood thinners for a few weeks after discharge to prevent heart attacks. How do I differentiate between heart attack and a normal chest pain? There is nothing like normal chest pain. One may be confused with gastritis or gas and heart attack. But any pain in the center of the chest, which causes sweating, which causes breathlessness, which is spreading to the jaw or to the arms, especially if it is not going away after 10 to 15 minutes, especially pain which is not relieved by taking an antacid, any pain which is significant enough to make you feel distressed and anxious, you should go to a hospital, get an ECG done, see a doctor. Because if it is gastritis, you will not have any problem. You will be sent home after maybe a few ECGs or echocardiogram and a blood test to rule out a heart attack. But if it is a heart attack, it will save your life. So whenever there is a doubt between a heart attack and gastritis or some other pain, think of a heart attack. It will be better to be safer than sorry. Next question is, how to differentiate between stroke and heart attack. Stroke is basically about brain stroke, where there is a clot formation in the brain or some bleed inside the brain, because of which you may lose control over one limb or one half of the body. There may be facial deviation, drooling of saliva, inability to close your eyes, vision disturbances, usually neurologic symptoms. There is no chest pain or breathing difficulty in a stroke generally, whereas a heart attack is about chest pain, breathing difficulty, and these symptoms. Diabetes patient treated with metformin has next question. Diabetes patient treated with metformin has normal renal function. Is a procedure like coronary angiography safe for them? Does metformin pose any kind of risk? Yes, if a diabetes patient is well controlled on metformin and the kidney function is normal, metformin does not pose any special risk. It is only in patients who have borderline renal function or impaired renal function, and if they are on metformin, we generally stop metformin for 2-3 days before angiography, because in case of deterioration of renal function after an angiography, it can lead to lactic acidosis, which is a condition which happens more commonly in patients who are on metformin and have a impaired renal function. But in somebody having normal renal function, there is no need to stop metformin before an angiogram. Is there any contraindication for angiogram? Who shouldn't have it? As I mentioned, there is no specific contraindication for an angiogram. I would say the only contraindication for an angiogram is somebody who is not willing to undergo an angiogram. If the patient says, no, I do not want an angiogram no matter what, except in an emergency like heart attack, I wouldn't proceed with an angiogram, because that is the most important thing, that the patient has to be ready and willing to undergo an angiogram and further treatment if required. Suppose somebody is not ready for a bypass surgery, suppose somebody is not ready for an angioplasty or stenting and wants only medicine, it may be okay to manage them on medication without doing an angiogram, because there's no point just seeing what is there if we are not going to treat it by putting a stent or bypass surgery. So that is the only major contraindication. Apart from that, of course, if somebody has very high blood pressures, very high blood sugars which are not under control, if somebody has kidney function which is impaired, and the nephrologist says that doing an angiogram is risky unless the patient is ready for dialysis, because somebody may have a creatinine level which is 4 or 5 and needs an angiogram, but they're not willing for dialysis. In such a patient, if we do an angiogram, they may go into dialysis, for which they are not ready, then we should not be doing that angiogram. But milder degrees of kidney impairment are okay, in whom we take special precautions like using a special kind of dye, using more IV fluids, hydrating them well before the procedure, giving certain injections to prevent kidney damage, and it can be done. But if severe degrees of renal impairment are present, angiogram is contraindicated. If anybody has severe allergic reactions in the past, especially if they have gone into anaphylactic shock, which is the severest form of allergic reaction in the past due to a contrast agent, that is a contraindication. But even in those patients, if an angiography is absolutely required, we can give steroids, we can give anti-allergy medications and do the angiogram safely. So these are the usual contraindications. But still, I would say, if somebody is not willing to undergo an angiogram for whatever reason, unless it's a life-saving emergency, we will not do an angiogram. What are the risks of angio? This I've already discussed. Minor allergic reactions, sometimes major reactions, deterioration of kidney function can be the usual risks. Rarely during an angiography, a stroke of the brain can happen. 1 in 5,000 or 1 in 10,000 angiograms is the incidence of stroke. Rarely during an angiogram, there may be a heart attack. Again, that is 1 in 10,000, where there are very severe blockages, in which case somebody may decompensate during angiogram, but these are very rare complications. We do not see regularly. The next question is, could I be treated with medicine instead of angioplasty or stenting? Are these life-saving? As I told earlier, uh, in case of a heart attack, yes, 100% life-saving. There is no doubt about it. If somebody is suffering from a heart attack, angiogram, angioplasty, stenting has to be done immediately, and that is the only way to save life, I would say. But in somebody suffering from angina, is more stable, has not developed a heart attack, in such a patient, it is possible in many of them to treat them with medical management, optimize diabetes and blood pressure control, give them anti-anginal medication, and if they're able to have a good quality of life without much impairment of day-to-day activities and physical exercise, it is okay to medically manage. But it is important in such patients to at least do a CT coronary angiography, rule out any major blockages. Especially we call something, there is something called left main coronary artery disease. One of the main arteries on the left side is blocked. In such patients, medical treatment is not safe. So if we can identify that by doing a CT coronary angiogram, those patients can be taken up for angiogram and the remaining can be medically managed for some time. But if on adequate medication people are not able to manage their symptoms, if they still continue to have significant angina, if their lifestyle is impaired, they cannot exercise regularly, they cannot climb stairs, they cannot do their day-to-day activities, then we may have to take them for angiogram. We can give a trial of medicine, but if it doesn't work, or if the medication produces too much side effects, they're not able to tolerate the side effects, again, we may have to do an angiogram, relieve the blockages. So in elective cases where the patient is stable, angiogram is not life-saving. It is more of improving quality of life, reducing pain, giving better quality of life, reducing the burden of medicine. Those are the main goals in elective cases, stable cases. But in a heart attack, definitely life-saving. So we have to differentiate. All angiograms are not same. Emergency angiograms are life-saving. Elective angiograms are more about quality of life and angina relief. Two different things. The next question is how long I need to stay in the hospital. Nowadays, we perform angiograms through the wrist, through the radial approach in most of the patients. So if it is only an angiogram you're getting admitted for, we admit in the morning, run the blood tests, do an ECG echo, do the angiogram. The angiogram hardly takes 10 to 15 minutes under local anesthesia. You will be conscious during the procedure. You can talk to the doctor. The doctor will talk to you after the angiogram, tell you what is the problem. And suppose it is only medical treatment and you're not going to do anything further, the same day evening you go home. So typically 10 to 12 hours of hospitalization. It's a daycare procedure, and most of the insurance companies also approve daycare angiograms, so you will be kept only till evening. But after the angiogram, there are major blockages for which you may have to undergo additional procedures like angioplasty. You may have to stay for another 1 or 2 days in the hospital if it is going to be done in the same setting. If you're not going to do the angioplasty in the same setting, you're going to take some time, then you will be discharged and you'll be asked to come back whenever you are ready, depending on the severity of blockages and what needs to be done. Suppose you are going to undergo a bypass surgery, you will have to discuss with the surgeon regarding the availability of the surgeon, when they will plan surgery, and accordingly a date will be given for surgery and you will be discharged. Or if the blockages are very critical and you will have to be operated quickly, you may have to stay in the hospital, continue in the same admission and get it done. Purely if it is an angiography, you will be discharged on the same evening, at the most the next day morning. Next question is how long after procedure can I get back to regular routine? You can get back to your regular routine the next day, especially with radial angiography, which we perform from the wrist. There is no scar, there is no bleeding, there is no pain. You can get back to work the next day. But of course, if you are undergoing additional procedures, that will be longer. Next question is what limitations will I have after the procedure, both short term and long term? In a coronary angiography, there are no limitations. You can get back to work the next day, you can start exercising the next day. The limitations will be if you have major blockages found on angiogram, then the doctor will advise your activity level according to that. If you have major blockages and angioplasty is done or a bypass is done, after that, after a week after angioplasty, you can get back to normal activities. After bypass surgery, after a month, you can get back to most of your normal activities. So it depends on what we find on the angiography. Angiogram is done normal, no blockages, you can get back to regular activities the next day. If it is blockages which are treated with angioplasty, 1 week. If it is a bypass surgery, 1 month. These are the typical timelines we look at. What follow-up is necessary after the procedure? And one more thing about limitations. Suppose somebody has had a heart attack and then undergo an angiogram and angioplasty. Up to a week, some amount of rest is required. You can walk around, do your day-to-day activities, but no heavy exertion for a week. After a week, you can get back to some amount of exercises. No driving for 1 month after a heart attack. And depending on how much is your heart function and how much of residual damage is there, your doctor will advise your specific activity levels. What limitations will I have after the procedure, both short term and long term? As I told, no real limitations after the procedure. The angiography is just a test. We are only looking for blockages. Suppose an angioplasty is done, bypass is done, based on how severe your disease is and how is your recovery, the doctor will tell limitations and what all can be done, cannot be done. But if it is only an angiogram you are undergoing, after that, absolutely no restrictions. You can live a normal life and nothing to be worried about. What follow-up is necessary after the procedure? Typically, if I do an angiogram today and discharge the patient by evening, I call them back after a week to see how they are doing, to check if their blood pressures and sugars are okay, if they have any pain at the angiogram site at the wrist or the groin, how are they doing in general about their chest pain symptoms or other symptoms they had. And suppose we have found something on the angiogram and we're planning further procedures, further discussion will be had when they come back as to how we should go about it, whether they want a procedure or whether they want medical treatment, whether they want the surgery or they want an angioplasty. There are some gray areas in which one may perform a bypass surgery or one may perform an angioplasty. Both things are possible. So we have what we call as a heart team approach, where a cardiac surgeon, a cardiologist, both of us sit with the patient and counsel them as to pros and cons of surgery, pros and cons of angioplasty, pros and cons of medical treatment. So based on these, your further follow-ups will happen. So this is all about coronary angiography, CT coronary angiography, about heart disease in general, about heart attacks in general. To conclude, I would say on this World Heart Day, the most important thing about preventing heart disease is to identify and take care of your risk factors, which are diabetes, blood pressure, high cholesterol, smoking, sedentary lifestyle, and stress. If you can reduce most of these risk factors and keep them under control, the chances that you will live a healthy and long life are very high, and you can prevent getting into a heart attack and its complications. But you should always know what to do in case of a heart attack, and most importantly, stop smoking. That itself will alone take care of a huge amount of risk. Thank you so much.